This is the Psychcast by MDedge, the official podcast of MDedge Psychiatry. And welcome to episode 153 of the Psychcast by MDedge. Coming up in this episode, we have a conversation about something called the MASK strategy for helping patients deal with pandemic-related anxiety. The guest is Dr. Eliza Menninger. She spoke with our host, Dr. Lorenzo Norris, the editor-in-chief of MDedge Psychiatry, about how you can help patients deal using this strategy. If you'd like to learn more about this, there are show notes available wherever notes are found in your particular podcast app. Okay, without further ado, let's welcome the host of the show and the editor-in-chief of MDedge Psychiatry, Dr. Lorenzo Norris.
This is Dr. Lorenzo Norris, editor-in-chief of MDedge Psychiatry. Today, we are pleased to have Dr. Menninger with us, who's going to talk with us about the effects of COVID-19 on people and really, again, starting to think about ways in which we can deal with this high level of anxiety to people, which I'm absolutely sure people are feeling, and really how we can just really think about what kind of resources that we internally have and how we can bring them to bear as we deal with all of the stresses related with the COVID-19 pandemic. Dr. Menninger, please, welcome to the Psychcast.
Thank you. I think that the anxiety I've seen is related to many things. There's a lot of anxiety sort of with people as they approach the holidays, how to manage. What I notice most with people is the kind of fear of the unknown, a lot of uncertainty, both of exposure to themselves or potentially exposing somebody else. Then there's another aspect of the isolation that has come with it, how a lot of people are working from home. And so there's a lot of stress about, feeling more isolated, the sense of feeling trapped in the home.
Mm-hmm.
And so those are the two big things that I've noticed with people, kind of feeling that they can't get out, but also the worry if they do get out, the worry of a potential exposure both to themselves and to those that they love.
Okay. Well, you gave us a number of different things in which we can focus on. What I wanted to do is maybe go back and just get your take on how the anxiety and stress has developed throughout our time and experience with the pandemic, maybe going back to March. You serve as medical director of the partial hospitalization program, and I'm sure you've seen firsthand in your patients as well as your staff how, again, the anxiety, while present, is maybe transformed in regards to what are the triggers or the stressors. So please go right ahead.
I think the first thing people noticed was significant uncertainty. Also, this just immediacy of just, you're not coming into work tomorrow, and we're closing things down. And suddenly you have to change everything. And I think people could really rally around that initially. Okay, we're gonna change that, we can manage that. But then as things adjusted, there was a sense of, well, how long is this going to last? Is this lasting a month or 2 weeks or longer than that? And when people thought about maybe longer than that, that was more challenging because, well, I can do this for a day. I can do this for a week. But you're talking about 6 months. You're talking about 9 months. I think people's anxiety sort of, well, what's the end game and what's the plan? And so there was a lot of uncertainty, both what's going on and what is this disease and how are we responding to, well, how are we going to sustain this so that it can be effective? We went from the partial, we decided to do a virtual day program. How are we going to sustain this? How are we going to keep up our census? Will insurance companies continue to pay for virtual? So I think that was the next step. And then there was the whole step of sort of, can I keep doing this? Not just that this is getting old, but is this enough for me? Should I be doing more? And when is the next wave?
Right. Let me just go back to that again, because that idea of the uncertainty and just trying to wrap your arms around that. And maybe you could share with us, because this gets into anxiety, but it also gets into practical points. I mean, you have to convert your partial program as medical director into virtual, I would imagine, like like all of us, kind of overnight. What were some of the challenges maybe in doing that, particularly with the idea of addressing patient anxiety and maybe even staff anxiety in regards to this uncertainty and, as you alluded to, like sustainability, and how are we going to navigate it?
I think that, my recollection was first that, people are not used to virtual. I think one of the great things that's come out of this is we realized that telehealth actually works pretty well, that you can connect reasonably well over telehealth. But I initially was like, well, we're used to in person. Is even going to be effective? So the first was, would this even clinically make sense? And then the next was, what's the technology to do this? And then the third is, how do you connect the staff around it so that you make sure you still have the sense of clinical cohesion treating the patients? So, we found that there were a lot of meetings first in person, and then as we realized, there was acknowledgement that you really did have to stay at home. How are we going to make this work technologically? There were a lot of amazing people that kind of figured out what platforms would use and how would we shift the program to continue to have groups in such a way that the patients could respond. And also, I think we rolled it out slowly so that the patients that first started were more comfortable and the staff were more comfortable. We tended to start out with patients who had been in our program and had to take a hiatus, so they knew what the program was. So we both kind of were in this together, because they'd stop suddenly, we had stopped suddenly. So they were able to come back and were excited because they knew what the program was. And then as we rolled it out, we could begin to invite more patients in because everybody was more familiar with the idea of the technology.
Absolutely. Now, Dr. Menninger, as the pandemic progressed and you're seeing things in the partial programming, we're ramping telehealth up. We are doing what we need to serve our patients. Did you see a change in the anxiety or any way that it transformed as you got into the summer? I'm really curious in regards to what you saw in the patients or even just your community in terms of that mental attitude or framework as we got into the summer. For some people, we might have been entering into the lower end of that honeymoon phase of the emotional phase of response to a disaster. I'm just curious what you saw in regards to the anxiety there.
I think it shifted from how are we going to make this work to how long are we going to have this work. So I feel like people shifted from, how am I going to see the next patient to how are we going to sustain this and for how long are we going to sustain this?
Yeah.
So I think initially it was sort of like, okay, we're going to do whatever we need to do to make this work. And then but we may have to do this for longer than 3 months. How are we going to sustain our morale?
Yep.
How are we going to support the patients? Because suddenly it is not just, a 1 month thing. It's how are we going to help support them around? You're going to probably have to work from home a lot longer. And so how are we going to support our patients about what are ways to manage working from home?
Absolutely.
Because that's a whole different ball of wax. How do you have a boundary for work? How do you have a boundary for home?
Well, we're going to get into that. I want to hear your thoughts about that, particularly as it relates to coping and, if you will, being flexible. But I wanted to go back to what you said during the summer, because as you describe it, you are so correct. I do think that things change. And when I think about the change, I go back to what you said earlier. Uncertainty, not knowing. I think about the initial stages of the pandemic. I literally think about it. There were kids making PPE because they thought, well, not incorrectly, that, because practitioners and patients were dying. We didn't have enough PPE. And then once we stabilized a bit, I feel like that fear started to transform into worry about how can we sustain, again, those kind of two components of anxiety. I think about that fear and that worry. How can we sustain? And I'll tell you another thing that I think started to hit, and maybe some of all the listeners out there, we are interdisciplinary. So everybody, my colleagues in nursing, social work, psychology, psychiatry, internal medicine, and we got even lawyers that listen to the not even definitely lawyers that listen to the Psychcast. Shout out to all of y'all. What I think about, in addition to that worry that Dr. Menninger is kind of started to make us think about, you start to experience loss. I didn't realize it until how much loss I experienced until I missed my daughter's 8th grade graduation. At first, I was kind of like, oh, what? Well, we're rallying. As Dr. Menninger said, we're rallying. But then all of a sudden, I realized, like, dude, that kind of sucked. I was looking forward to the 8th grade graduation. And I started to think about everybody who missed those graduations and all of those type of things. And that starts to, because you're like, wait a minute, is everything going to start to be like this? How long can I sustain? So now take us into like that, in terms of that, how long can I sustain? What are different things that you've seen in regards to what people have been doing to sustain to this point? What type of coping has been there, or what has been working from your vantage point in the partial program?
Right. I think the biggest piece is kind of, how do I word it, accepting that it's different. If you can sort of, if you can realize your daughter was not the only one who had to go through virtual 8th grade graduation. We're not alone in this. And I think so one of it is acknowledging it's different and allowing yourself to say, yeah, it's different. But if different means next year, I'm going to be able to celebrate Thanksgiving with my family as opposed to this year, that's a good thing. I mean, we had trouble when seatbelts we had to wear them, who wanted to wear a seatbelt? But then you realized, hey, if I wear them, I actually might survive a crash. So I think part of it is acknowledging different is different, but it will get us, if we can be healthy, we'll get to the next year. So part of it is recognizing the resilience. The other, I think, is, I have this sort of acronym I came up with called MASK.
Okay.
And, M, it stands for make boundaries. So when you're at home, working from home, make sure work is in one area and home is in another area. Because if you can have the boundary, then you don't roll out of bed into your workplace and just feel it's so blurred. And then you're kind of always in one place 24/7. You really separate things out, which I think will help your sense of remembering what it was like to commute to a place and have a separate space, work versus home. A is avoid the virus. So recognizing one of the things we've learned is how to avoid the virus. We know how to do that. And my favorite is, for those who used to sing to their kids, head, shoulders, knees and toes, knees and toes.
Okay.
I think about it, hands, eyes, mouth and nose, mouth and nose. And then you can find a way to realize we can manage this virus and protect ourselves and those we love. S is stay connected.
Okay.
Instead of connecting, we're doing a lot of connecting via the virtual, but it's connected. How when you see somebody, feel like they're present in the room with you, and make sure it's not just a virtual thing that you can click off and suddenly they're gone, but they actually feel present. And then the K is keep the faith. We have a vaccine, we have hope. And I think that's one of the things I help with my patient. You can manage this. We have managed this far. If you've managed this far, if you've managed since March, you can manage to next March. And that looks like when things are going to roll out and we'll be in a better position. So, keep the faith, have humor, have hope. We can do this as a team. We are all in this together.
Okay. All right. I'm really, really, really loving the mask. I love that. And as a guy, many of the listeners know I'm a big DBT fan, and Marshall Linehan we trust, as well as a lot of things. But I love the mask. The reason I love the mask, I feel like getting the mask right now. I'm putting one on because the mnemonic, or acronym rather, it's active. Like every time I do it, I can think about it. So that's like, you need to write a paper on something like that or put that out there or trademark it or something. But let's go through that a little bit, because I think that this can be very powerful for ourselves as well as our patients. And talking with other folks that have been on the Psychcast, this pandemic is different in so many ways. But for me, at least, the biggest difference is that we are all going through it. So absolutely, one of the things that I think about is whatever we recommend for our patients, it gosh darn sure better work for us too. All right, so let's go through making boundaries. I want to just go through, we go for a piece by making boundaries. What do you think is a key improvement area or mistake that people make or overlook when they're trying to make boundaries in the extent to this in this pandemic, like something they should avoid?
So well, I'm always amused that people kind of focus on the negative. I focus on the positive. So I think part of it is being overt about creating them. So
Okay.
rather than just rolling out of bed, that you get up, you wash, you pretend as though you're going to go to work,
Okay.
as opposed to just throw something on and like 5 minutes later turn on your screen. That you act as though the same behavior that you would be doing, and also take breaks. I mean, I think the idea of the Zoom fatigue is real. So make sure
Right.
you overtly shut off your screen, get outside. Keeping connected is connected with the world
Right.
and your people, your friends, your family. And I think you have to, it's easy when you're in a room, four walls, to just feel so closed in and trapped. And people are feeling more trapped. And I think part of the reason is you got to get out. You got to realize, sure, it's going to be winter, as Thrones says, winter is coming, but that doesn't mean you can't still go outside. Yeah, you're going to have to wear coats, etc. But the world is still out there. So make sure you overtly kind of create times when you get out.
When I think about that in terms of the make boundaries, and I like that you started with how you start. And one of those things that I think about in terms of making boundaries, one of them actually starts with your own internal sense of boundaries.
Yes.
And how you, if I've heard you correctly and felt that, how you internally say, wait a minute, the boundary of me getting out of bed and going to work needs to be maintained, and I need to not even act as if I need to do that. And so that's a very important thing. I think that's hugely important in terms of that internal boundary. Now, with the avoid the virus, look, I can't top you. I can't sing like that. I mean, I like can you do the head, shoulder, knee? What, can you say the song again?
It is, it's hands,
Okay.
eyes, mouth and nose. Because the hands can wash, the eyes, I really urge people to get some sort of eye protection, even if they go out in public. It's just easy and it does protect you. And then the mask is mouth and nose. So it just is something you can always remember, have easy in your car. You get in from grocery shopping, you sanitize your hands and you take off your mask. I mean, there's such a pattern and it's doable.
No, I'm with you. I mean, I'm actually just trying to think about I like how you did it, but I'm actually trying to think. I put a challenge out there to the listeners. If anybody can put that to a pop beat or a hip hop beat or whatnot, I want to hear it. Send it in, and honest to goodness, I will go on a podcast and recite it, because that's how. Because somebody is out there, some artist out there, they can put this in the audience who can do this or put it into an additional music. But what the thing is that I like is that whatever it is that you do to avoid the virus, it needs to be part of your routine, and it has to be something that sticks with you, that grabs. That's another part of your I think it's like that attention, that's something that grabs your attention to avoid the virus. And now the next one, the S, because I got to hear more about this. The not just to connect, stay connected, which is very different, because, and let's be honest, we've been dealing with the issue of a whole bunch of connection with no connectedness.
Exactly.
Since we as a matter of fact, connection without connectedness, depending on what generation that you're in, I think there's no bigger stress of anxiety or worry than anything I've ever seen than debating whether or not 100 or so people like or dislike what your most recent post. So again, that go for it. That connection without connection or connectedness.
And actually, the beauty of that came from a patient. It was a patient who said that, and I'm just like, dude, you are right on. The sense of connectedness between ourselves, between our colleagues, between our family, and I also think between our country. If we can find a way to remind ourselves we are in this together.
Yeah, first off, can we let's give a shout out to our patients. One of the things I always tell my residents and my medical students is, the people who teach you are your patients. Make no mistake that everything, whatever textbooks you might be reading, shout out to NYU and Kaplan and Sadok and all those folks, all that was paid for. Every single piece of knowledge that we have was paid for. And I always tell folks, if I learned something smart, I learned it from a patient. If I say something like goofy or whatever, that was me trying to be cute and too much of an academic. But let's go back. So again, that idea of a patient said it, like, you know, connected. What can we think of? What maybe has been, and I'll share one, like in terms of maybe something that you've heard a patient or a colleague or someone do where they've really transformed that just connecting to connected. What's maybe one thing that you've seen somebody do that might stick with folks listening?
You know, truthfully, the thing that always jumps to mind is humor.
Yeah.
I feel like if somebody can make you laugh, you know, it feels so visceral and just, you know, genuine.
I love the humor. I love the humor. I actually think along with, I think humor, music, exercise, nutrition, sleep. I may have missed a few, but those are your frontline meds. I say that all the time, but I love the humor. I'm going to add to it because it flows into my example. You can really stay connected with people if you know how to turn your conversations into stories and narratives that people can participate in. So when I hear a really good story that makes me laugh and just cry to tears, I feel connected. And we can take inspiration from folks in the arts. Like, how does a comedian connect with people? Like, folks can feel connected. I mean, you just have to really work at how you do it. But I do want to go back to something that you said was so very important. I just got off of the phone with a colleague who said that they were so incredibly stressed by the political turmoil in this country. Look, we are not getting into politics. We are not just taking one political side or another. We are about health. But I do agree with what Dr. Menninger said, that one of the biggest issues here is that we are not connected. We are not connected. And when I think about that, I'm going to quote one of my colleagues. She may have said it herself, but she says it all the time, and I love it. We have stopped being curious about what other people think.
Exactly.
Please go ahead.
Exactly. I think the more our hope is to understand each other and to realize, you know, I have this sign behind me that says, what people really need is a good listening to.
Mm-hmm.
I think we need to do more of that, you know, just listen. You know, when you listen, there's a wonderful book called The Art of Hearing Heartbeats. And what we need to do, we need to hear what other people are feeling.
Okay. I agree with you completely. So it's, and like anything, hearing, spirit of curiosity, all of those things, if you will, take time and effort. And I'll probably share, you know, just again, all of this in terms of connectedness lends itself with like taking time, mindfulness. It lends itself with any type of psychotherapeutic approach that you want. But again, going back to what Dr. Menninger said, you want to, I like, that's why I kind of like the mask. Not kind of, I really like the mask because we're looking for things that can kind of package up a lot of different things that are immediately at our disposal that we can actually like use real time. Now, the final one, likely my favorite, keep the faith. Keep the faith. What does that mean?
I feel like, you know, one of the things I have on my mailbox is a heart that says hope.
Okay.
You know, we will get through this. It will end. We are resilient people, nation. You know, and it's just remembering. You know, I think it's just one step at a time, and just, you know, put one foot in front of the other, like the abominable snowman did when he learned to walk. You know, and so you just have to keep remembering. You know, I'm not, you know, the more you say I have supports, you know, I'm not alone. I have hope.
Okay.
You know, as I say, my old gray-haired daddy used to say, keep the faith. And it's like, okay.
Okay. All right. Keep the faith. All right. Now here, let me ask you a couple things in regards to keeping the faith. Can you give me an example when a member of your staff showed you something or demonstrated something in the midst of this pandemic where you're like, wow, that gives me a sense of hope? Can you give me an example?
Oh, I think the desire to kind of, what are we going to, you know, how do we help address what's happening with this patient? I have some ideas. you know, working together on rounds to say, how do we put this all together to help this patient cope better? You know, just, I have an idea, just the willingness to kind of, I like your term, shout out. What about this? You know, the desire to kind of collaborate and say, our emphasis is we want to make a difference, and here's some ideas we have.
Okay. And then the other one was, can you give me an example of from the partial program, or just even themes or examples where your patients have done some things where you're just like, whoa, now that's hope with teeth. That's hope that works. That's keeping the faith.
I think their ability to be creative about how they think about their jobs, their lives, their interaction with their family, whether or not they're creative about how to, you know, connect with their family, just that willingness to keep trying. I think that's the thing that I'm always impressed by, because everybody feels overwhelmed, you know, in terms of how am I going to do work, and how am I going to do, you know, treatment, and how am I going to take care of my family? And, you know, the fact that they keep trying, and
Absolutely.
it's just, to me, that in and of itself is huge.
Yeah, I agree with you. I mean, when I think of, there's so many examples, but I think one of the ones I can think of recently with one of my patients, really in a very difficult spot. And he said, well, you know what, Doc, as I start to think about this, I'm going to, we'll use a bit of what Dr. Menninger did. We can say this is reframing, if you will, also, but we're going to think about the positive. And he said, you know what, I'm going to use this pandemic as a time where there are a lot of people I shouldn't have been in contact with. So I'm going to use this and not be in contact with them in terms of the substance use. And I actually remember I used to go to church. Hey, I might as well try it now. I'm going to be in a homeless shelter. I'm going to be doing things, but I figure if I go to church, I can start to work my way up and I can do some things or X, Y, or Z. So I was just like, whoa, that's all right. That's all right. That's kind of getting at what you're saying. How can I build off of this? The other thing, when I think about my colleagues and everybody out there listening, and I know people, as depending on when this drops, unfortunately, you're going to be at capacity in your hospital beds. Your ICUs are going to be full. You may or may not have had your Thanksgiving plans canceled. You may have had, at this point in time, people, certainly patients that you know passed from COVID-19, loved ones that you know with COVID-19, or those that haven't passed from COVID-19. And what I would say is that the way in which people, just to me, the very basic way in which people, where I'm like, wow, folks just keep showing up to work.
Yeah.
Just keep showing up, and they believe in what it is that, why we are here, and what our mission, our humanitarian mission is. So, Dr. Menninger, again, you have given me a very, 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 anybody who knows me, I like it short and sweet. You've given me an exceedingly powerful and useful, if you may kind of think about this. So every time I think about it, or I put on a mask, I'm gonna think about what it is that you say. I'm not gonna be able to do the song, but I most certainly am gonna be able to think about keeping the faith. So, Dr. Menninger, I want to thank you for being with us on the Psychcast today.
The one last thing I'll say, which is what you have pointed out beautifully with your patients and what you've said, is that people have used this time to be creative.
Yeah.
They've taken advantage of this to say, what are some things I would have done otherwise that I can now do? And to really encourage that creativity, just like you did and just like your patient did. That's the beauty of it, you know, to use this time to build on your strengths.
All right. Well, there we have it. Build on the strengths of creativity. Dr. Menninger, thank you so very much for joining us on the site.
This was a real pleasure. You are just a treat to talk with, and I really appreciate being involved and helping in any way I can.
And that's it for this episode of the Psychcast. The Psychcast is produced by MDedge editors Gina Henderson and Jeff Bauer. All of our podcasts are produced by MDedge executive editor Kathy Skarbeck. The host of the show as the editor-in-chief of MDedge Psychiatry, Dr. Lorenzo Norris. Our guest this week was Dr. Eliza Menninger, and the notes are authored by Dr. Jacqueline Posada. You're listening to the Psychcast.